Morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and today I'm providing an update on the district's response to COVID-19, and we will be available for any questions following a brief update. I'm joined by HCMA Director Chris Rodriguez, the district's Homeland Security Director, and Dr. LaQuandra Nesbitt, the Director of the District Department of Health, or DC Health. Today we report 81 new cases of COVID in the community, in our community, and sadly, 3 Washingtonians have succumbed to the virus. We report each day on metrics related to the level of community spread, our health system's capacity, our public health capacity, as well as community engagement. And you can continue to find that information on coronavirus.dc.gov. Today, we are also announcing an updated travel advisory, as I mentioned we would. I will be signing a new mayor's order that goes into effect this Monday, November the 9th. And today, I will mention the highlights of what it will require. Under the new travel advisory, people who are visiting DC will need to get tested 72 hours before traveling to the district. Obviously, if they get a negative test, they should not come to the district. And we are also recommending, or also requiring, I should say, that anyone who is a close contact of a confirmed case should not travel to the district. And for people who are here longer than 3 days, we are asking them to get tested 3 to 5 days within their arrival to the district. We want it to be very clear that those who are traveling, that especially right now with increased cases of COVID-19 around the country, travel should be restricted as much as possible. That's why last week I shared our holiday guidance, and we continue to ask you to refer to that guidance. We asked residents to celebrate the holidays at home or close to home. That said, we want people to be safe and smart if they do travel. Limit your activities to reduce your chances of getting infected, and use testing to understand your exposure and help you to know whether you were infected. Testing, of course, has its limitations. A negative test today could be a positive test tomorrow. And just because a person tests negative does not mean that they will remain virus-free, and they can infect another person. That is why testing must be used carefully and in conjunction with other strategies for stopping the spread of COVID-19. Under this updated guidance, private institutions such as universities, employers, hotels, hospitals, congregate care facilities, and houses of worship will be able to ask visitors about their recent travel and may require a record of a negative COVID test. Just like under previous guidance, there are some exceptions. Visitors from Maryland and Virginia are exempt. People coming to D.C. for essential work may carry out those duties prior to receiving the results of their second test, as long as they don't have symptoms and as long as they weren't in close contact with a positive case. Visitors coming to D.C. for less than 24 hours are also exempt. And people traveling to D.C. for a family emergency or funeral do not need to obtain a negative test prior to coming, if obtaining such a test would be impractical. However, they will need to restrict their activities to those related to the emergency. For DC residents who are traveling back home, you have 2 options: to limit your daily activities and self-monitor for 14 days upon your return, or limit your daily activities and get tested approximately 3 to 5 days from your return. So before we take questions, a few more updates. I want to remind residents about their flu vaccines. If you have not gotten a flu shot, please get one as soon as possible. We have extended our partnership with Walgreens at the F Street testing site through Thanksgiving. So if you need a flu shot, you can go Monday through Friday, 9 a.m. to 1 p.m. We also want to draw residents' attention to something we have listed on coronavirus.dc.gov that is new. At-home tests are available through LabCorp. There are available at the LabCorp site, and you can pay for a test, use your insurance, or take advantage of an option to utilize federal funds to cover the cost of the at-home test. So if you're interested in obtaining an at-home test, you can go to coronavirus.dc.gov/testing for more information about how to do that. More on health insurance. We were joined last week, I think, or 2 weeks ago by the director of DC HealthLink. And this is a reminder that on November the 1st, you were able to begin participating in open enrollment, and residents are encouraged to sign up for high-quality, affordable health insurance. Most of the plans this year have lower premiums than last year, and all of the plans cover COVID-19 diagnosis, testing, and treatment. So again, go to dchealthlink.com to make sure you're insured. Finally, we announced over the weekend that residents will no longer need to bag their leaves, as DPW will continue to vacuum leaves. So in other words, what that means is there's been no change to how we do leaf collection. The leaf collection will proceed this year just as it has proceeded last year and many years prior to that. So see the schedule about when your neighborhood will have its leaf collection, where our DPW crews will come to your community and vacuum leaves that you have moved to the tree box. Please, not the parking areas, but the tree box. Collections begin this Monday, November 9th, and you can go to dpw.dc.gov. So with that, we will take a few questions. Yes.
All right, can I ask a few questions about how this travel advisory works for those who don't live in the district who are coming here? First of all, when it says that they have to get a test before they travel, is anybody checking that at the airport or the train station or something when they arrive?
As I mentioned, private institutions may ask, whether it's a university, hospital, or some others that I mentioned, for people entering their institutions to provide a negative test. There won't be a checkpoint, if you will, at the airport or other transportation stations or highways or bridges.
When it says that if they're visiting for more than 3 days, you ask them to get a test once they're here, are they free to do whatever they want in the meantime? If they get here, can they, go to public events, or they have to stay?
We've asked them two things. We've asked them to be tested before they come and have a negative result, and if they have a positive result, not to travel anywhere, we would hope. We also ask them to not be a close contact of someone who is positive in travel. We continue to ask everybody to self-monitor and limit their activities when they are awaiting test results.
Go through the steps here. So they get here, they get tested once they're here. Is that something that they can do at the district's public testing sites? We're going to provide tests for them?
We, as you know, already provide tests to people who work here and visit here and live here.
And just finally, can I ask you about how this fits with the message from last week, which was have Thanksgiving at home, don't host guests, do Zoom calls with your family, making it much, much easier for people to travel, no more 2-week quarantine. Do those two go together at all?
They do. We continue to ask people to limit their travel and to stay at home. We also know that people are going to come here and that they're more than likely not going to quarantine for 14 days if they do. So we want to ask them to be very, if they are going to travel here, to test before they come and to test when they get here if they're going to be here more than 3 days. Yes.
Hi, so how exactly will this be enforced? When they get that negative test, will they be required to show it to somebody? I know you said that university.
Yes, I just mentioned how that private institutions can request that someone show a negative test result. Yeah.
But other than outside of those private institutions, will there be any kind of city effort to enforce this rule?
The Department of Health always has at its disposal the ability to enforce our regulations in the interest of public health. But as I mentioned, nobody is going to be asking you at the airport or on bridges or roads or at the train station to show your papers. Any other questions?
Yeah,
Yes.
So if I could follow up on this. So if a hotel, for instance, is asking for this, is travel required to do them in a hotel? Refuse service, can any of these private institutions refuse service to someone who doesn't provide? And and I want to just clarify, if somebody's coming in for more than 3 days, you want them to test before they leave their home state and then again within 72 hours of arrival?
Between 3 and 5 days once they get here.
You want them to test before they leave?
Yes.
So that's 2 tests you would like them.
That's correct.
Okay, and so back to my original question, if a hotel is asking for this, or an employer or an institution is asking for this, is it enforceable? Can they refuse service to someone who says, yeah, I'm not going to provide you that data?
Yeah, so we will lay out in the mayor's order all the enforcement mechanisms for private institutions, Mark. And it is our intention that this is a tool for them to manage travelers, people coming from who are traveling. There will be another group that we will update of states that would be exempt in addition to Maryland and Virginia, who we think are low risk based on the level of COVID transmission in their community.
Is that Monday's new list, or is that something separate from the Monday list?
It replaces the Monday list.
And so could you explain that? You're going to, instead of listing states that are high-risk states, you're going to do the reverse and list?
Exactly. That would be exempt
So it'll
from.
just be a shorter list.
It is a much shorter list. Yes.
So Mayor, this would be up to the hotel or the institution. I mean, they're not required to do it, they can do it.
Exactly.
And does that new list start on this Monday? I've lost track of the.
November 9th is Monday, yes.
And that's when the new list will come out, and it'll be the reverse list.
Yes.
Okay, thank you.
Okay,
Can I
yes.
ask about the LabCorp home testing?
Yes.
Is that something new that
It is
not-
new, and I'm going to ask Dr. Nesbitt to
Yeah.
say a little bit more about it. And we may have more to say about it still as our plans develop.
Sure. So there are not very many FDA, EUA, emergency use authorization tests, PCR tests in particular, that can be administered, self-administered at home. LabCorp has a test that can be administered at home, doesn't require a health professional or medical professional to administer the test. So we are constantly looking for ways to expand access to testing and to ensure that residents in the District of Columbia know about all of their options for access to testing. And so this is another way that we are ensuring that residents know about all of their options for testing. The first thing that we want residents to do if they believe they need to be tested is to contact their healthcare provider. The second thing that we do is ask them to come to any of our public sites for testing. We operate public sites across the District of Columbia, equitably distributed 6 days a week. And the third thing that we are now ensuring that people know about is this option for an at-home COVID-19 test kit. LabCorp does accept insurance for these test kits. Many of you know that we have worked very hard in the District of Columbia in partnership with the Department of Insurance, Securities and Banking, the Department of Healthcare Finance, to ensure that our residents, where we have a high rate of insurance coverage, can have their COVID diagnosis, testing and treatment services covered by their insurance provider. So you can pay for the test, use your insurance, and there are some federal programs that are in place to cover the cost of the test. We have used this program. The total turnaround time from ordering of tests and receipt of results ranges from about 3 to 5 days. So we do find this to be an appropriate mechanism for individuals who are at home, would like to receive the test kit at home and not go out to a site, or who have been in communication with their healthcare provider and their healthcare provider doesn't offer testing within their own private practice. This can be another great tool. Yes.
And can I ask, back to the requirements for travel, are you requiring a PCR test or are you accepting a rapid test as well?
So the PCR test is the preferred negative test result that we will be looking for to be received within 72 hours of return, and it is the test that should be used within 3 to 5 days once you return, or in the district.
If I could just, one last question for a colleague who's talking to restaurant owners in the district today who are frustrated with the restrictions and how hard it is for them to keep their businesses open, and they look to some other surrounding jurisdictions where the restrictions aren't as strict maybe as they are here in the district. Just what is your message to restaurant owners as we're headed into the colder seasons? It's going to be harder. I know you've done the outdoor grants and whatnot, but what is your message to restaurant owners who are having a hard time?
Well, there are a lot of people having a hard time, and certainly the cause of the hard time is COVID-19. It's not restrictions. It's the fact that we still have a virus that's circulating, not just in our city, but across the country. And so to those restaurant owners, I would tell them we're doing everything that we can, using the best that we know about public health to keep residents in the district safe. Okay, thank you.